Hello, my name is Claire. I am a tissue viability nurse working for the Leicestershire Partnership NHS Trust. You may be watching this video because you have a pressure ulcer, or you have been identified as at risk of developing a pressure ulcer. But what are they, and how do they happen? You may have heard pressure ulcers referred to as pressure sores or bed sores. However, they don't always occur just from lying in bed. There are also several factors that can increase your risk of getting a pressure ulcer. For further information, please refer to our other video, Knowing Your Risk. Let's start with what a pressure ulcer is. A pressure ulcer is an injury or open wound which occurs when you have been lying or sitting in the same position for too long. This can reduce the blood flow to the skin. Blood contains oxygen and nutrients required for healthy skin. So if it is reduced for too long, it causes the skin damage that we know as a pressure ulcer. It often starts as a sore area, either red or discoloured skin, which may also feel warmer, cooler or squidgy to touch. It may also feel quite painful. Common areas for pressure ulcers to occur are on the bottom, lower back, hips, elbows, heels and spine. However, they can happen anywhere on the body where pressure is a factor. In light skin, a Category 1 pressure ulcer is an area of red skin that doesn't turn white if you press on it. If you have dark skin, it can be difficult to detect. It can appear slightly darker, however, it's important to be aware what is normal for you. How does the area look or feel? It may feel painful, warmer or cooler, or feel more firmer, softer compared to the adjacent skin. It's important to observe these skin changes, as if discovered before the skin is broken, it can be reversible. Your nurse or health professional will show you, or the people who care for you, how to test the skin, to monitor for these changes, and will advise on how effectively to remove pressure from the area. Please also refer to our other video, How to Check Your Skin. A Category 2 pressure ulcer is when the top layer of skin comes away and presents as a shallow ulcer, which is red or pink. It can also present as a blister filled with clear fluid. The area is usually round in appearance and is in the same position as the surface it has been in contact with. Category 3 pressure ulcers are deeper. This is when the skin is not only damaged, but it has gone through the fatty layer of tissue. This can sometimes be seen within the ulcer. These ulcers can be superficial or deep, depending where on the body. A Category 4 pressure ulcers are deep ulcers where there is a hole in the tissue, where bone, muscle or tendon could be visible or felt within the wound. Whilst all open wounds carry a risk of infection, Category 4 pressure ulcers carry a high risk due to their depth. Infection can get into the bone. This is called osteomyelitis, and there is an increased risk of sepsis, which is a life-threatening condition in response to an infection and sometimes referred to as blood poisoning. Unfortunately, in some cases, infected Category 4 pressure ulcers have led to amputation of a limb and death. Sometimes it is not possible to categorise a pressure ulcer at first. These ulcers are called unstageable. This is because there is dead tissue within the wound that prevents the bottom of the wound from being seen. A nurse will advise on a treatment plan to remove the dead tissue, if this is appropriate. Once the dead tissue is removed, the pressure ulcer can be categorised. Unstageable pressure ulcers usually turn into a Category 3 or Category 4 pressure ulcer. Some people will develop deep tissue injuries, or DTI for short. This is discoloured but intact skin that can look like a bruise, but there has been no fall or injury, or it can present as a blood-filled blister. This indicates damage to the underlying tissues. Again, if you have dark skin, they can be difficult to detect. Therefore, it's important to observe the skin for any changes, as previously covered. Deep tissue injuries can turn into open wounds, usually Category 3 or Category 4. However, if the pressure is removed, they can also get better before the skin becomes broken. Now that you know what they are, let's look at how they happen. As well as pressure from being in one position for too long, other things can contribute to them developing. Pressure ulcers can also be caused by shear or friction. For example, If you are slipping down in your bed or chair, tissue underneath the skin can be damaged. Or if you have spasms that cause your legs or arms to rub on the surface, the skin can be damaged. Moisture to the skin can also contribute to pressure ulcers developing. However, moisture without pressure can also cause open wounds on your skin. These are known as moisture lesions. A nurse will assess the area and advise on the cause. Moisture can be caused by urine or feces, sweat, saliva, or wound fluid. It is not always caused by sitting or lying. If you are stiff or contracted legs or hands, you may also develop pressure damage from the way your body is positioned. If you use a medical device such as oxygen mask, prosthetic limb or catheter, for example, you could get pressure ulcer if they are not fitted correctly, or if you are lying on the tubing. These are called medical device-related pressure ulcers. Unfortunately, if pressure is ongoing, it can quickly develop into an open wound. If this happens, it is important that the wound is seen by a nurse for assessment. Depending on the depth of the pressure ulcer, the nurse will categorise the pressure ulcer as a category 1, 2, 3 or 4, unstageable or deep tissue injury. I hope you have found this video useful. If you have any queries, please speak to your nurse or health professional. Pressure ulcers can happen to anyone, but risk can be increased by certain factors. You can find out more about your risk factors in our other video, Knowing Your Risk. Pressure ulcers can be caused by direct pressure, but can also happen because of shear, friction, and in combination with moisture to the skin. Changes to the skin may be difficult to detect on dark skin. Therefore, it is important to be aware of what is normal for you and be vigilant. Pressure ulcers can be life-changing and have serious complications, including death. It is important that we do everything we can to prevent them. Most pressure ulcers are avoidable with appropriate care planning.